Hi, everyone, and welcome to today's interview. Today, we're having this conversation in honor of National Donor Day, which is observed on February 14th as a day to raise awareness of organ, eye, tissue, blood, platelets, and marrow donation. Our guest today is Dr. Glenn Morgan, who is the Chief of Transplant Surgery at Hartford Hospital and the Medical Director of St. Vincent's Medical Center Transplant Clinic, and he's here to shine some light on the topic of living kidney donation. Dr. Morgan, thanks very much for coming on the show today.
Thank you very much for having me.
Absolutely. To start off, would you like to introduce yourself and share what you do in your roles at Hartford?
Sure, thank you. So as Kira said, I'm the Chief of Transplant Surgery at Hartford Hospital. We are a large transplant center. We do perform our transplants at Hartford Hospital, but we have outreach clinics in Fairfield here and also in Norwich, which we opened just this year. We perform liver transplantation, kidney transplantation, and heart transplantation, and we've been growing steadily since I joined the program in 2020. We have a fantastic team, over 100 individuals who devote their blood, sweat, and tears, their heart and soul into the transplant center and transplant recipients every day. And it's a very gratifying work, and I love being there and doing what we do with that team every day.
Amazing. Looking forward to talking today and hearing more about the transplant program. So, for background, would you like to give us an overview of what living kidney donation is and when it's indicated?
Sure. So people who have end-stage kidney disease, who are on dialysis or are nearing dialysis, have really only one way out of that eventuality, and that's to get a transplant. So transplantation can be offered in two ways, either with a living donor or with a deceased donor. Deceased donors are, of course, people who have made the decision to donate their organs upon their death. But living donation is an active choice made by people who are either aware of the recipient's plight or have made a decision altruistically to come forward and donate. So for living donation, there are certain advantages, several advantages that we like to make sure our potential recipients are aware of. And so we strongly encourage living donation for all of our recipients, and to sort of get the word out that they're even in need of a donor. Because a lot of the times when living donors haven't stepped forward or don't know how or where to step forward, it's because they aren't even in the loop as to who might need an organ. So with living donation, there's three distinct advantages. The first is time. Living donors can come forward, be evaluated, be tested, be approved to be living donors at the same time as the recipients that they came forward on their behalf of are being evaluated and tested and listed. And once both parties are ready, a transplant can happen immediately. Whereas on the other side of the coin, with deceased donor transplantation, that process, even though they can be listed, the recipients, it can take years for them to come to the top of the list because there are literally tens of thousands of other people already on that list. And so living donation offers the distinct advantage of time, getting your transplant done years earlier than you might have otherwise done. Living donation also offers, in general, a kidney that lasts longer and is what I would describe as of better quality. And so the kidneys, unfortunately, kidneys do not last forever, but we know that with a living donor, on average, that kidney will last anywhere between 2 and 4 years longer than the kidney would that comes from a deceased donor. Both are tremendous gifts, but there's certain advantages to the living donor. We also know that kidneys from living donors tend to work immediately upon the completion of surgery before the patient has even left the hospital. Those patients will go home and they're not even on dialysis anymore. And we know with the deceased donor kidney, that also happens quite frequently, but not as robust immediately as with a living donor. So several advantages. We strongly encourage and promote living donation in a big way in our program, and it's always been a very important part of Hartford Transplant.
That's fantastic. Thanks so much for explaining how it works. So, would you like to walk us a little bit through the process of living kidney donation, from considering potential donors to the procedure itself and the recovery?
Absolutely. So the most important thing we do is we start with the recipients when they're listed. Even as they're being evaluated, we say, look, we know that you're not asking people to donate on your behalf. There can't be any coercion. There can't be any elements of them being convinced. So what they need to do is just get the word out, as I said before. And if someone does come forward and say to them, look, I want to be tested. I want to learn about the process. I want to be educated. All our recipients need to do is say, thank you so much. Talk to my team. And we give them information so that the potential donor can reach out to us to be tested. Because to be a donor, there are two things that you have to have evaluated, and that's what our team's job is. The first is it safe for you to have this surgery? Is it safe for you to go through the surgery where a kidney is removed so that it can be donated to the potential recipient? So that's the first thing, evaluation for safe surgery. And the second thing, of course, is how well are you going to be for the rest of your life with only one kidney? And so that also involves a very thorough evaluation, consideration of family history, consideration of genetics. So many things go into the process because there's no such thing, first of all, as 100% guaranteed safe surgery. No matter how well surgery goes, no matter how safely we perform the operation, there's always a chance complications can occur. So all we can do is the best we can do, is let these potential donors know that we've evaluated them and we consider them as safe as possible to go through the surgery. And again, on the other end, to make sure that they're going to live the rest of their life with only one kidney that's a really good kidney, and that they themselves are not going to end up having some sort of chronic kidney disease or need a transplant themselves in the future. So those are the two single most important things. They have to come to us, we do the testing, and then if they're approved and the recipient's on the list, we can do the surgery. Now, the surgery is done minimally invasive, which means either laparoscopically or robotically. It's typically a 2 to 3 hour operation. These operations are performed at Hartford Hospital, and most donors will go home the next day or possibly 2 days after surgery. They have routine follow-up with the surgical team for 1 or 2 weeks, make sure they've healed well, and then they go back to normal activity by 4 to 6 weeks. There's no need for extra medicines. All the medicines that we talk about in transplantation are taken by the recipients. The donors have had surgery, but it's no different than having a gallbladder out or having your appendix out. Once you're recovered from the surgery, you're recovered. We're always there to take care of donors should events happen, complications, or any questions we're there to answer. But it's basically the recovering from a surgery that's a very well-controlled surgery and a surgery that's done tens of thousands of times in the last decade or so. We do about 50 living donor transplants a year at Hartford Hospital, and we have amongst the best results in the country. We're very proud of the program. We have an entire team dedicated to just living donation. Nurses, doctors, coordinators, dietitians, pharmacists, ethicists, psychologists, a huge team, and living donation is an integral part of the success and the mission of our program at Hartford.
That's amazing. Thanks so much for breaking down the process for us. So what are some of the supportive services that are typically available for both donors and recipients during this process?
Right. Yeah, as I said, there are so many people involved because the decision to donate is such a complex one. And it's not just about the physical. The physical stuff, going through the evaluation, going through medical testing, going through lab testing, having a CAT scan done, having an MRI done, having any of the medical testing is stuff that obviously the patient can't control. If we find abnormalities, if we find things that are going to preclude that person from being a donor, it's a purely objective decision, and we're very honest and transparent. You can't do this. It's not safe. Either it's not safe for you, or maybe something is potentially unsafe for the recipient that we're thinking of using your kidney for. So the medical stuff is, if anything, the stuff that the donor can't control, but it's easier to make a decision because it's more black and white. It's either going to be a yes or going to be a no. But we also have to prepare them psychologically, what they're going to deal with, particularly if they've never had surgery before, particularly if they've never even contemplated doing something like that. So in addition to the medical team that our patients or they're being evaluated for donation see, they see a social worker, they may also see a psychologist, and if necessary, a psychiatrist. There's also something called an independent living donor advocate, which is an unbiased third party that goes through the process with the patient to determine whether the patient has felt any outside coercion or pressure to donate. Because the thing is, this has to be voluntary. At all levels, it has to come from the heart. It has to be a voluntary decision. In no way can the donor be perceived as having been coerced. There can't be any payment. There can't be any mental or psychological pressure placed on the donor to do this, because this is a completely selfless act. And so we go through an exhaustive process to make sure that nothing but the safest processes are being followed for these people who come forward to give essentially the gift of life voluntarily.
Wonderful. No, it's great that there's so many services set in place to help make this process seamless. And from a like a bigger standpoint, from your perspective, what are the biggest barriers that prevent more living kidney donations, such as misinformation, logistics, and what are some changes that would help make a difference?
Yeah, no, that's a great question. Yeah, because it's interesting. Living donation, even though it's the one thing within our field that we have a little more control of, it has not really increased a lot in the last decade. So we would love to see more and more living donors come forward. I think a lot of it is awareness, and that's why we're constantly talking to our recipients about getting the word out, making sure that people around them, their communities, their families, their loved ones, even people they may not know of, need to be aware of their situation so that they can think about whether this is an option for them. So we tell them, look, if you're on social media, get the word out. And it's something you very awkward to ask. You can't really ask. You just have to sort of put it out there so that people are aware. So using social media, we have ways to help them set up little websites for themselves to make information available. Not to ask, but to just sort of make the situation known. It's almost like having a status out there on social media, or letting people know that you are, quote unquote, in the market in a way that's not sounding coercive, in a way that's not asking, but just saying, look, I could use help. It's entirely up to you whether you want to, come forward. But that's really the most important thing. I think because people are generally good. I like to believe, maybe I'm an optimist, maybe I'm very idealistic, that most people are good. And I think if more people knew about the situations that people around them are in, they would come forward. Because we would certainly love to see more and more people come forward as potential living donors so that we could evaluate them. Because it's a much better option for the recipients if we can just get more people to the finish line, or as I like to think of it, as the start line.
Absolutely. And this goes along into my next question, which is for National Donor Day, what's one message you'd like to share to raise awareness about living kidney donation with our audience?
Yeah, I think the most important is the awareness. I think you have to, trust yourself, trust your own internal compass to do the right thing for people around you. I know that lately we've been plagued by some negative publicity in the transplant field. Nobody is consciously doing anything but positive things in Hartford and what we do for our patients every day. And so getting the word out, feeling positive, making sure that everything is very honest and transparent within our field, informing our patients, whether they be on the donor side or the recipient side, educating them, communicating with them. I think that's the best way to come forward. Access is everything, okay? Even getting patients in on the recipient side is always a challenge. So getting those recipients to let potential donors be aware, it just sort of, it's a filtering down situation. So the more people who are aware about transplant in general to get themselves the health, if the recipient, and hopefully that'll qualify, to have more people on the donor side come forward as well.
Awesome. Well, it's a great message to wrap up on. So thank you so much, Dr. Morgan, for your time today and helping us to shine a spotlight on donation and raising awareness.
Thank you for having me.